Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study that sheds light on a concerning neurological condition affecting horses. This research, conducted between 2017 and 2021 at the University of Pennsylvania, Bolton Center, examined 100 horses that were diagnosed after death with a neurodegenerative condition known as equine neuroaxonal dystrophy or equine degenerative myeloencephalopathy. These conditions have been recognized in veterinary medicine for over 40 years. Historically, equine degenerative myeloencephalopathy was understood as a widespread degenerative condition primarily affecting the thoracic spinal cord. Another early investigation described equine neuroaxonal dystrophy in Morgan horses, noting similar degenerative changes such as nerve fiber degeneration, increased glial cells, fluid-filled spaces, and pigment accumulation, but these changes were mainly found in a specific area of the brainstem called the accessory lateral cuneate nuclei without significant microscopic changes in the spinal cord. Later studies in quarter horses with equine neuroaxonal dystrophy also identified degenerative changes within a specific nucleus in the thoracic spinal cord. Over time, the distinction between equine neuroaxonal dystrophy and equine degenerative myeloencephalopathy became clearer, with a general agreement that equine neuroaxonal dystrophy is a more localized form of equine degenerative myeloencephalopathy that does not involve significant degenerative changes in the white matter of the spinal cord. Initial reports described these conditions in younger horses, typically between birth and 2 years of age, and in specific breeds like Arabians, Thoroughbreds, quarter horses, and Morgans. A familial predisposition to equine degenerative myeloencephalopathy was also documented in several breeds. The clinical signs originally associated with equine degenerative myeloencephalopathy included symmetrical incoordination and weakness in all 4 limbs, usually first observed between birth and 1 year of age. These signs were indicative of problems with the upper motor neurons and the general sense of body position, without involving the cranial nerves, cerebrum, or cerebellum. Unfortunately, a definitive diagnostic test that can be performed on living horses remained elusive, with examination after death being the most conclusive method of diagnosis. However, in the past 5 to 10 years, veterinary clinicians have observed an increasing number of adult horses exhibiting behavioral changes alongside incoordination. Upon examination after death, these horses showed nerve fiber degeneration in the brainstem and spinal cord regions previously associated with equine neuroaxonal dystrophy and equine degenerative myeloencephalopathy, but without other clinical or pathological findings that could explain their unusual behavior and incoordination. These horses often differed in breed and age from those originally described, leading to the question of whether this represents a different manifestation of the same disease or a separate condition with similar microscopic lesions. At Bolton Center, equine neuroaxonal dystrophy and equine degenerative myeloencephalopathy were once commonly diagnosed, then decreased in frequency, only to reappear in the last decade. It remains unclear whether this resurgence is due to actual changes in the occurrence of the disease or increased clinical suspicion. To better understand this phenomenon, researchers at Bolton Center conducted a retrospective study to describe the history, clinical signs, and microscopic findings in a group of horses that showed evidence of neurodegenerative disease upon examination after death. Their aim was to provide a comprehensive picture of this condition as it is currently being observed. The study included 100 horses that had undergone examination after death between January 2017 and December 2021 and were found to have nerve fiber degeneration consistent with equine neuroaxonal dystrophy or equine degenerative myeloencephalopathy, without the presence of other lesions that could fully account for their clinical signs. To be included, the horses had to have degenerative changes in the brainstem, characteristic of equine neuroaxonal dystrophy, or in both the brainstem and spinal cord, consistent with equine degenerative myeloencephalopathy. These changes were identified by the presence of more than 10 swollen nerve fibers per specific anatomical area in the gray matter of the brainstem and spinal cord. For a diagnosis of equine degenerative myeloencephalopathy, similar nerve fiber swellings in the gray matter had to be accompanied by degeneration of the nerve fibers in the white matter tracts of multiple segments of the spinal cord. Horses that had imaging or gross findings suggestive of narrowing of the cervical vertebral canal, but without microscopic evidence of spinal cord compression, were also included. All horses in the study had been evaluated by a board-certified veterinary internal medicine specialist at Bolton Center, which included a thorough neurological examination assessing attitude, behavior, cranial nerves, posture, muscle condition, sensation, spinal reflexes, and gait. The gait examination involved observing the horses walking and trotting in a straight line and on curves, walking with the head elevated, their response to tail pulls, and their ability to navigate hills with the neck in different positions. Many horses also underwent additional diagnostic procedures such as X-rays of the cervical vertebrae, cone beam computed tomography of the cervical vertebrae, analysis of cerebrospinal fluid, and myelography, a procedure involving the injection of contrast material to visualize the spinal cord. The severity of incoordination was graded on a 5-point scale for both the front and hind limbs. Information about the horse's breed, age, sex, history, neurological examination findings, cerebrospinal fluid analysis results, blood and cerebrospinal fluid tests for specific infectious diseases, and imaging results were collected from medical records and through communication with owners, trainers, or referring veterinarians. Notably, information regarding exposure to toxins and insecticides was not systematically collected. Upon analyzing the data from these 100 horses, the researchers found a median age of 8 years, with a range from 1 to 22 years. The majority of the horses were Warmbloods, accounting for 72 cases. Other breeds included 15 Thoroughbreds, 5 quarter horses, and 8 horses of various other breeds. 80 of the horses were geldings, 18 were mares, and 2 were stallions. Regarding their history, 73 horses had a history of incoordination. 69 horses had a history of abnormal behavior, either while being ridden or on the ground. 35 horses were reported to be performing poorly, and 27 had a history of lameness. For most horses, 68 in total, the primary reason for seeking veterinary attention was behavioral changes, with 37 of these also showing signs suggestive of incoordination such as frequent tripping or falling. The behavioral changes reported were diverse and included unpredictable spooking, dangerous or aggressive behavior towards humans and other horses, unusual excitability or anxiety, sudden explosive reactions, abnormal dropping of the penis, unwillingness to work under saddle, rearing and bolting, periods of disorientation, and a blank expression or unusual calmness even when faced with stressful situations. Other main complaints included incoordination alone in 30 horses, behavioral changes alone in 25, lameness alone in 4, poor performance in 3, and inflammation of the eye in 1 horse. The duration of clinical signs was known for 33 horses, with a median duration of 90 days, ranging from 1 to over 1,000 days. During the clinical evaluation, 83 horses were presented to the Internal Medicine Service for a neurological assessment. 17 horses were seen by other specialty services for issues like poor performance. 28 horses showed changes in their mental state, and 26 exhibited abnormal behavior during the examination, such as dullness, a blank expression, aggression, excessive spooking, anxiety, and overreaction to stimuli. Interestingly, horses often fluctuated between periods of unusual dullness and hyperactivity. 6 horses had abnormalities detected during the cranial nerve examination, including a delayed or inconsistent blink response in 1 horse, weakness of the tongue in 2 horses, tongue weakness combined with a deviation of the muzzle and a head tilt in 1 horse, and misalignment of the eyes with a head tilt in another. Crucially, all 100 horses displayed signs of general incoordination affecting their sense of body position at the time of presentation. For all of them, the way they walked was consistent with a problem originating in the cervical spinal cord or a more widespread issue affecting the spinal cord, leading to a general lack of coordination and upper motor neuron weakness in all 4 limbs. 1 horse also showed signs of vestibular incoordination, affecting balance, and another had signs pointing to problems in multiple areas of the nervous system, including cranial nerve deficits and general incoordination. The severity of general incoordination ranged from mild to moderate, with an average grade of 2 out of 5 on the modified scale. The median grade of incoordination was slightly higher in the hind limbs compared to the front limbs. 26 horses were lame upon arrival. The range of motion in the neck was decreased in 11 horses. 1 out of 20 horses that had an eye examination showed pigment changes in the retina. Diagnostic imaging of the cervical vertebral column using standard radiographs was performed in 86 horses, and 57 of these showed abnormal findings. Among those with abnormalities, 50 had osteoarthritis of the small joints in the neck vertebrae, and 7 had narrowing of the cervical vertebral canal based on measurements of the spinal canal diameter. A cervical myelogram, using contrast material to visualize the spinal cord, was performed in 58 horses, and 14 showed a narrowing of the contrast column by more than 50%, suggesting spinal cord compression. Cone beam computed tomography of the cervical vertebrae was performed in 14 horses, revealing osteoarthritis of the small neck joints in 8, narrowing of the openings for nerve roots in 5, and mineralization of an intervertebral disc in 1. In 3 horses that had computed tomography after myelography, the findings suggested spinal cord compression. In terms of clinical pathology, serum amyloid A concentrations, a marker of inflammation, were measured in 3 horses and were normal in all. Plasma fibrinogen concentrations, another inflammatory marker, were measured in 66 horses, with 23 having levels above the normal range. Serum vitamin E concentrations were evaluated in 60 horses, and 6 had levels below the acceptable range. Cerebrospinal fluid analysis was performed in 74 horses. Most samples were clear and colorless. Abnormalities in the cerebrospinal fluid were detected in 28 samples, including an elevated protein level without a corresponding increase in cell count in 22 samples, evidence of blood contamination in 3, a mild increase in neutrophils in 2, and a mild increase in lymphocytes in 1. Blood and cerebrospinal fluid tests for equine protozoal myeloencephalitis, a common neurological disease in horses, were performed in 71 cases. While many horses had antibodies in their blood indicating exposure to the causative agents, the pattern of antibody levels in blood and cerebrospinal fluid was not consistent with active infection in any case. Similarly, tests for Lyme disease using blood and cerebrospinal fluid were performed in 66 horses, and the results were not consistent with a diagnosis of Lyme neuroborreliosis in any case. Phosphorylated neurofilament heavy chain, a marker of nerve damage, was evaluated in blood and cerebrospinal fluid in 27 horses. Elevated levels in blood were found in 2 horses, and elevated levels in cerebrospinal fluid were found in 8 horses. Regarding treatment and outcome, 16 horses had been treated for equine protozoal myeloencephalitis before being seen at New Bolton Center. 3 horses had been treated for suspected Lyme neuroborreliosis. 6 horses received joint injections in their necks, and 6 were given vitamin E supplementation. Sadly, 62 horses were euthanized on their first visit. For the horses that were re-evaluated, the median time between the first and last visit was 42 days, and the median time from the first evaluation to euthanasia was 7 days. Among the 37 horses that were seen again, 21 showed a worsening of their incoordination, and 20 showed a progression of their behavioral changes. The median grade of incoordination at the time of euthanasia was 2 out of 5. The most definitive findings came from the examination of the brain and spinal cord after death. In all 100 horses, the researchers found bilaterally symmetrical nerve fiber degeneration in the gray matter of the brainstem. The lateral cuneate nuclei, areas involved in transmitting sensory information, were the most consistently and severely affected, with lesser involvement of other brainstem nuclei and the reticular formation. The microscopic lesions consisted of swollen nerve fibers, which varied in size and staining characteristics, sometimes accompanied by clear spaces, degenerating or dead neurons, an increase in glial cells, and the accumulation of a pigment called lipofuscin. In 24 horses, there was also mild nerve fiber degeneration in the white matter tracts of the spinal cord, most apparent in the middle to lower thoracic segments. 3 horses had gross evidence of narrowing of the cervical vertebral canal, but the spinal cord tissue adjacent to these areas did not show the typical pattern of degeneration associated with compression. In the horse with vestibular incoordination, examination after death of the middle and inner ear was unremarkable. The researchers then discussed these findings, noting that the horses in their study differed significantly from those originally described with equine neuroaxonal dystrophy and equine degenerative myeloencephalopathy. The median age of 8 years and the predominance of warmbloods were distinct from the younger age and overrepresentation of breeds like Arabians in earlier reports. While the first reports of equine degenerative myeloencephalopathy described incoordination in young horses, this study highlighted that clinical signs might not appear until later in life in some breeds, potentially due to a genetic predisposition leading to a later onset of neurodegeneration. The overrepresentation of geldings was likely due to the types of performance horses seen at the referral center. A striking difference from earlier descriptions was the common occurrence of behavioral abnormalities such as aggression and increased reactivity in the horses in this study. In fact, the primary complaint for most horses was behavioral changes, sometimes without owners initially recognizing the mild incoordination. These behavioral changes included unpredictable spooking, hypervigilance, periods of dullness, and difficulties under saddle. These findings align with more recent reports of horses with nerve fiber degeneration showing atypical behaviors not apparent in older literature. The underlying cause of these behavioral abnormalities remains unknown, as the researchers did not find consistent microscopic abnormalities in brain regions typically associated with behavior. It is possible that subtle changes were missed with standard staining techniques, or that relevant brain areas were not examined in every case. However, the lack of detectable structural abnormalities suggests that functional disturbances at neurotransmitter level, possibly linked to factors like vitamin E deficiency, could be playing a role. The researchers also drew parallels to behavioral changes seen in human neurodegenerative disorders, suggesting that similar underlying mechanisms might be at play in horses. The researchers also discussed the potential causes of the disease, highlighting the role of oxidative stress, potentially due to antioxidant deficiency or excessive oxidative stressors. While a simple genetic cause seemed less likely given the variety of breeds affected within the warmblood population, genetic factors are likely important, with recent research suggesting that horses with equine neuroaxonal dystrophy might have an abnormal metabolism of vitamin E. Although many horses in the study had normal vitamin E levels at the time of testing, it is possible they experienced periods of deficiency earlier in life. The observation that many affected warmbloods were imported from Europe raised the possibility of environmental factors, such as limited pasture access on some European breeding farms, contributing to vitamin E deficiency. Environmental toxins have also been implicated in nerve fiber degeneration. Similar to previous studies, the researchers found no single antemortem diagnostic test that consistently identified horses with equine neuroaxonal dystrophy or equine degenerative myeloencephalopathy. Serum vitamin E levels were often normal and do not necessarily reflect past deficiencies or tissue levels. Cerebrospinal fluid analysis showed only nonspecific changes in many cases. The nerve damage marker, phosphorylated neurofilament heavy chain, had low sensitivity as a diagnostic test. Currently, a definitive diagnosis still requires examination after death, with clinical diagnosis based on recognizing the characteristic signs and ruling out other conditions. However, the combination of incoordination and notable behavioral changes in adult horses, particularly warmbloods, increases the suspicion for this condition. The study also noted the common occurrence of other cervical vertebral problems in horses with nerve fiber degeneration, which can complicate diagnosis and treatment decisions. The fact that some horses with imaging suggestive of cervical spinal cord compression were ultimately diagnosed with nerve fiber degeneration after death might explain why some horses undergoing surgery for presumed cervical compression do not improve. The researchers acknowledged several limitations of their study, the primary one being the lack of a control group of healthy horses to compare the microscopic findings in the central nervous system. The accumulation of swollen nerve fibers can be seen as an aging change in other species, and this possibility cannot be entirely ruled out in horses, although clinical correlation is lacking. While most horses in the study were under 15 years of age, age-related changes could still be a contributing factor. It is also possible that the observed nerve fiber degeneration was not the primary cause of the clinical signs, but simply the most prominent finding during routine examination after death. More advanced techniques might be needed to fully understand the extent of the degeneration. The possibility of concurrent peripheral nerve issues also exists. Other limitations included the use of serum vitamin E levels instead of tissue samples and the fact that the pathologist reviewing the tissue samples was not completely blinded to the horse's clinical histories. In conclusion, this study provides valuable information on a large group of horses with neurodegenerative disease, highlighting a different profile in terms of breed, age, and clinical presentation compared to earlier descriptions. Nerve fiber degeneration remains a significant cause of neurological problems in horses. Whether a single underlying cause or a combination of different factors leads to these findings remains to be determined, emphasizing the ongoing need for focused research to improve antemortem diagnosis and ultimately, the health and welfare of affected horses. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.